All right, let's get more specific in on mobility. This is where all the fun stuff starts to happen. So, as we age, right, we start to lose mobility. We start to lose our range of motion. And our job, part of our training program, one, to prevent injury, but also two, to prevent the loss of range of motion. So, what type of things decrease our mobility as we age? We have diseases, of course, like arthritis, which will decrease our range of motion. We have injuries, muscle tightness, and adhesions. And for the sake of this video, we're going to focus on muscle tightness and adhesions. Those are a little bit less medical. So adhesions, most people know these as by the term of knots. So adhesions, it's a fibrous tissue that can form because of many different reasons, but the biggest one is just because of injury. So what actually happens, right? So let's look at this right here. Let's say that this is a weight, in that person's hand, and they are, right, there's their head. They're trying to curl this weight up towards them. Normally, right, without adhesions, the muscles should be able to move very freely. But what can happen, right, let's say that there's our muscle tissue, where it actually get little adhesions that are binding tissues together, preventing them from moving correctly. So today we're going to go over how to get rid of those. But first, let's go ahead and visualize this a little bit better. Let's look at some actual examples. So here's a nice picture of what adhesions look like. And then an actual picture. This is really cool. I really like this. Look at that. These materials, don't know if you can see that or not, but basically it's like a cobweb type material. It's actually binding things together, preventing them from moving correctly. So how do we get rid of these adhesions? Right, there's many different ways. The technical term for removing adhesions is a myofascial release. Myofascial release, or as you'll see sometimes, SMFR. SMFR, which stands for self-myofascial release. Right, myofascial release, that's the idea behind massage therapy, breaking up adhesions, allowing your body to move freely again. Or SMFR can be done with a tool called a foam roller. Right, I don't know if you've seen one of these at your gym or anything like that. Basically, what you do is you have your foam roller, and then say you need to roll. Here's your knee, there's your hip. You need to roll the outside of your leg. And you'll see people rolling along their side, right, back and forth across their muscles, basically breaking up these adhesions and allowing their muscle tissue to be able to move through a full range of motion. Again, right, this is a huge thing, doing SMFR, to keep your mobility and keep your muscles able to move through a range of motion while implementing any fitness program, especially when you're moving heavy weight a lot. You can tend to get very stiff and lose your range of motion. Using a foam roller is one simple way to prevent this from happening. Muscle stiffness is another huge cause to loss of range of motion. So let's go over how to relieve muscle stiffness, how to prevent our muscle stiffness from decreasing our range of motion. There's different types of stretching, basically. It's all just stretching that will decrease muscle stiffness and increase our range of motion. There's ballistic and dynamic, which these are very similar. Active, passive, static. Passive and static are similar. And then isometric and PNF. PNF, there's the big one right there. But let's go over a couple of these more specifically. The first type of stretching that we have is ballistic and dynamic. When you think ballistic, right, I always think bouncing movements. So if you ever see somebody doing Frankensteins, where they'll hold their hands out in front of them and then they'll kick one of their legs up and try to touch their toe and back down, that's an example of a dynamic or a ballistic movement. The difference between these two, well, first, dynamic basically just means by using movement. So that you mean dynamic, you're not stretching and holding. You're moving in order to increase the range of motion or warm up or stretch. So the difference between the two of these, dynamic and ballistic, is ballistic, you are trying to force you're trying to increase the range of motion. You're trying to force it past its normal, your comfortable range of motion through bouncing or kind of jerky movements. So if you were to do this exercise over here and you're not doing it slowly, you're doing it quickly and maybe adding a skip in with it, that would be ballistic. But if you're just walking and slowly raising your leg up to touch your toe, then that would be dynamic. This is the best type of exercise to use while warming up. This is the best way to warm up your muscles, right? We don't want to necessarily stretch and hold before we lift weights or before we do our training. That's counterproductive, right? We need to warm up dynamically or ballistically, but using movement. That's the best way to warm up. Static stretching is very simple, right? That's when we think of stretching, we think of static stretching, the typical stretch and hold. If you see somebody doing this, where they're just reaching forward, trying to touch their toes, or somebody, if they're bending down, trying to touch their toes, things like that. It's basically where you're just holding a stretch. In order for this to be effective, you have to do it for 8+ seconds. 8+ seconds. That's how long it takes for our body to be able to relax into a stretch, right? If we're stretching and holding for just 2 or 3 seconds, that could be actually counterproductive. This type of stretching, our static stretching, is best for cooling down, right? During our cool down. That's when we want to use this. Our next type of stretching or relieving muscle stiffness is called PNF, or proprioceptive neuromuscular facilitation. This is my favorite type of stretching. I am very tightly wound, I'm very stiff, and it's hard for me to increase my range of motion. This is one of the only things that seems to work for me, which is why I'm such a huge fan of PNF stretching. So let's talk about what is PNF stretching. What does proprioceptive neuromuscular facilitation mean? Let's make it a little more simple. So what happens is when our muscles lengthen, right? They're stretching. We're lengthening our muscles. Here's our muscle. We're pulling away, right? It's tensing the muscle tissue. When that happens, there's a message that's sent to our brain, which then is sent to our Golgi tendon organ, saying something's lengthening this muscle, contract it so that way we can prevent injury. So that's why when you go to stretch, at first your muscles tighten. It takes about 8 seconds 8 seconds, which is why I keep saying 8 seconds as far as, when to hold, how long to hold your stretch for, at least 8 seconds. After 8 seconds, your Golgi tendon organ sends a message to your brain, which then tells your muscles to relax. So here's how PNF stretching works. Let's move this over here to the side. Right, I don't know if you've seen this in athletics, right, athletic trainers doing this, but basically what they're doing here in this picture is PNF stretching. So you are passively or not doing any work, right? She's holding his leg up for him, increasing the range of motion, pushing against, right? So his muscles are tight, they're stretching. So you hold that for 8 to 15 seconds. And then after that, what he's going to do is he's going to push down against her shoulder as hard as he can for 6 seconds, right? You don't want to strain your muscle or anything like that, but you want to push pretty hard. And what this does is it tricks your muscles into relaxing, so therefore you can increase your range of motion even further and go even deeper into a stretch. And typically you want to do this 2 to 4 sets per leg or whichever muscle group that you're stretching.